terms of ways that we might help our society understand correlation between choices they make and the cost that leads to health care, we have certainly done things in this country to tax tobacco products. We've certainly done things in this country to tax alcohol and things that lead to poor choices, but we have not done anything with respect to high-fat or sugary type convenience store foods. And I think that we as a society are at a point that we might want to start to consider a disincentive for people to eat lunch out of a vending machine for 30 years. If they're eating Twinkies or different things like that, I think those are foods that ought to be taxed to pay for a program of care for the indigent American citizens who lack insurance.
Is that something you like to see on the federal level or on the state level? Or?
I think in my own opinion, I think it would be effective on the federal level. I don't know that it would be effective on the state level. But certainly if they were to do something on the federal level, I think it would give them a source of funds to pay for care for the uninsured and provide a disincentive for a pretty horrible trend in this country as it relates to obesity, according to the CDC.
The least government would be the best thing as far as health care. In other words, the government decrees what groups will get some extra help.
Right.
That's what we do as Americans. We're very benevolent and charitable, and we help people, right? And so what they have proposed is more government intervention. And let me give you some examples. Medicaid is bankrupt. Medicare, everybody's saying it's going bankrupt. You know, Congressional Budget Office, you ask any group, government groups, they say it's going bankrupt. And what is their solution? Their solution, we're going to, quote, control costs. You know how they control costs? They ratchet down the payments. Right now, if they don't do what they are calling in jargon the doctor fix, it's going to be a 20% cut in payment shortly. Guess what that means to patients? Forget the doctors for a moment. It's like you have a grocery store, and the government decrees that you have a lot of people around this table like to eat steaks. And we come to you to buy steaks. Well, the government decrees you can only sell a steak. You can sell steaks only for $1, that's all. But your supplier sells it to you for $1.20. So you're going to lose, you can't make it up on volume, you lose 20 cents on every steak. So consequently, what happens? You stop selling steaks. And that's what happens. And what happens to the people who want to buy steaks? They don't have any steaks to get from you, right? And so that's what happens. As the price goes, as a price fix down, people on Medicaid can't find doctors. Sure that health system reform benefits the patients of America, and to make sure that physicians and the other professionals who render care to patients can deliver that in the best possible way. Some of the things that the coalition is concerned about, one would be H.R. 3200. H.R. 3200, as you know, is over 1,000 pages, 1,017 or 18 pages. You can download the text and go through it at your leisure. But what happens with that bill, it takes control away from the patients and the physicians. The vision of the coalition would be to have the patients in control of his or her own destiny. In other words, the patient would own the policy, the physician would be the trusted advisor to the patient.